Hip internal rotation is one of the most common limitations I find in any golfer, especially on that lead side. What happens is as you try and rotate through impact, you run into this lead hip, and if it's limited in rotation, a lot of times you'll rise up, you might try and flip your hands or throw your hands at it to compensate. You're going to end up with ball flight all over the place. So lead hip internal rotation is key. So I want to walk through a series of movements designed to improve hip internal rotation. The first thing we're going to do is just take setup posture, and we just want to go through our swing motion. So we're going to go to the back swing, pause, down swing, pause. So as we go into the back swing, you're going to internally rotate the trail hip. As we go into the downswing, we're going to internally rotate the lead hip. So we'll do a few of those just to get the feel. Notice any limitations, any tightness, any pain. Now, sometimes we can't improve hip internal rotation. So if you're having a lot of pain or pinching, then I might skip this video and look to get consulted by someone who's TPI certified through the medical aspect, and you can find out what's keeping you from getting more hip internal rotation. Next, we're going to take a golf club. We're going to set it down right in front of us. We're going to do what we call stork turns. So you're going to go on one leg, and all you're going to do is rotate your hips into that internal rotation position. So really, we're just loosening up right now. We're going to get a lot more aggressive in the future. So now, just pretty easy, getting the hip moving. And we'll do the other side. Again, lead hip is more common limitation, but it doesn't mean we don't ever have it on the trail hip. If you have trouble balance, you can drop your back toes down, still putting most of the weight through your leg and rotating into hip internal rotation. Now, we'll keep this for balance, and what we're going to do is we're going to stand, and then we're going to take this bent knee and rotate it into internal rotation. For internal rotation, that position, you're going to see the foot go away from your body. So you want to feel this motion. We're just going to swing it back and forth a handful of times. Again, just getting the feel for the movement, starting to loosen up hip internal rotation. So all the tissues are warm when we get more aggressive in a few minutes here. And again, this might feel kind of gritty or awkward to you. If that's the case, it's probably a good chance you are limited in hip internal rotation. All right, we can set that club aside. We're going to make our way down to the mat and working through some other internally rotated positions. First, we're going to make our way down to your back. Then we're going to hit a very similar series of movements where we just try and internally rotate while we're laying here. We'll do one hip at a time. We'll do each side maybe 10 times. One of the things I like to see when we're trying to improve mobility is just a lot of reps into that new motion. So you can perform a dynamic stretch or something like that to improve hip internal rotation, but unless we get a lot of repetitions of the movement, it's just not going to stick. Now for this next part, I'm going to grab a yoga block. I'll put a link in this video to where you can get these. They're relatively cheap. If you don't have one around, you want to make something do in the meantime, you might be able to use a basketball, something of that type of size and shape. What I'm going to do is I'm going to take this block, I'm going to make it narrow, I'm going to squeeze, I'm going to bring my feet out to the side, so when my knees are inside my hips, I'm internally rotated. And when I do that, I'm going to press into the block, press my feet into the ground, and do a few cricket bridges. And we're just finding more and more ways to help our hips accommodate to that internally rotated position. And let's do 3 more. 3, 2, and 1. Next, we'll bring both our legs up. We're going to continue pinching that block together. I'm actually going to take it sideways to make it a little bit wider. And then I'm going to try and internally rotate here. By pressing my knee into the block, I kind of give myself a counter force, give myself a point of rotation for the hip internal rotation to happen around. We'll go to the other side a few times. All the while trying to maintain your breathing, try and stay pretty relaxed. And we'll drop the legs down. Nice exhale to make sure your breathing is calm. We can take the block out of the equation. We'll set it over there for now. And then we're going to go into this pretzel breathing position. So we're going to take one leg, 90-degree bend in our knee, put it out front. We'll take our other leg, 90-degree bend, facing that way. We'd like to bring our arms right out in front of us, palms up, bend back this way, and just breathe. Now, if you find yourself kind of stuck in this position, that's fine. Use a hand. Help yourself stay upright and just work on breathing here. I promise, you do this a few times, in 3-4 weeks, you'll be finding yourself much more upright. And then we're going to look at that leg behind us. We're going to push our knee into the ground and lift our foot off the ground. Now, you may not lift very high, especially if you have a limitation in hip internal rotation. That's okay. We're just trying to get better at it. So we're going to lift that a handful of times. We'll say 3, 2, and 1. Then we're going to turn, bring our forearms to the ground, and we're going to breathe here for a short period of time. Now, the reason I do this is because what happens is even though you're going to undergo hip rotation at your pelvis, your obliques and your abs and your lats are going to be doing something completely different. So we've got to get used to those muscles and joints going in different directions, which is why I like this position. And after we breathe here a few times, we're going to come back up. Then we're going to do a few more lifts on that leg. And what you might start noticing around now is you're getting a little bit higher up there. You might start noticing the hip is loosening up. You're gaining better control of hip internal rotation, and it's already getting easier. After 3, 2, 1, we're going to go ahead and switch our legs to the other side. We're really looking at the same position, just hips are on a different side. Now this side could be tighter or looser than the first side. And once we're here, again, we're going to bring those arms up. And again, you find yourself stuck this way, use a hand, bring yourself upright, and work on this position until it gets easier. Once we've been here a little bit, we're going to go ahead and lift that leg, and we're going to start internally rotating. Again, this can be a really awkward position at first. You can really lean out this way. It might help you early on, but the better we can do it upright, the more we'd like to. Okay, now we're going to take that turn, dropping the forearms to the ground, and then we're just going to breathe, trying to relax. Feel those obliques, the lower back all loosen up. Let's say 2 deep breaths here, and 1 more breath. We'll make our way back up. We're going to try and lift that foot again a few times. Again, after I do that, I feel like I actually gain a little bit of range of motion. 3 more. 3, 2, 1. Now we're going to make our way back up to standing. So now we've taken our hips through a lot of different internal rotation positions. I'd like to test it out and see how it feels. So find your way into setup posture. Go to back swing, hold here. Notice how the hip feels, and then down swing. Back swing, trail hip, down swing, lead hip. Now hopefully that feels like it's started to loosen up for you. It's not all going to happen just today. Keep this video nearby. I would say a good 3 times a week as you're really trying to improve it. And after you get improved hip internal rotation, I'd still come back and work on it every once in a while, because you've already shown that your body wants to lose it sometimes, so you're going to have to work a little bit harder to maintain it.